Vitamin D3 is a form of vitamin D used in the treatment of specific medical conditions such as refractory rickets, hypoparathyroidism, and familial hypophosphatemia, as well as osteoporosis and chronic kidney disease. In this video, let's found. What is cholecalciferol? What is cholecalciferol used for? Contraindication. What are the side effects of taking cholecalciferol? How does cholecalciferol work? How to use cholecalciferol? What is cholecalciferol? Cholecalciferol, also known as vitamin D3 and cholecalciferol, is a type of vitamin D that is made by the skin when exposed to sunlight. It is found in some foods and can be taken as a dietary supplement. Cholecalciferol is made in the skin following UVB light exposure. Cholecalciferol was first described in 1936. It is on the World Health Organization's list of essential medicines. In 2020, it was the 60th most commonly prescribed medication in the United States, with more than 11 million prescriptions. Cholecalciferol is available as a generic medication and over-the-counter. What is cholecalciferol used for? Cholecalciferol use is indicated for the treatment of specific medical conditions like refractory rickets, or vitamin D-resistant rickets, hypoparathyroidism, and familial hypophosphatemia. Concurrently, as one of the most commonly utilized forms of vitamin D, cholecalciferol is also very frequently used as a supplement in individuals to maintain sufficient vitamin D levels in the body or to treat vitamin D deficiency, as well as various medical conditions that can be associated directly or indirectly with vitamin D insufficiency like osteoporosis and chronic kidney disease, among others. Contraindication. Do not use cholecalciferol in the following cases. Hypercalcemia. Patients with primary hyperparathyroidism. Malignant disease. Williams syndrome. What is cholecalciferol used for? Cholecalciferol use is indicated for the treatment of specific medical conditions like refractory rickets, or vitamin D-resistant rickets, hypoparathyroidism, and familial hypophosphatemia. Concurrently, as one of the most commonly utilized forms of vitamin D, cholecalciferol is also very frequently used as a supplement in individuals to maintain sufficient vitamin D levels in the body or to treat vitamin D deficiency, as well as various medical conditions that can be associated directly or indirectly with vitamin D insufficiency like osteoporosis and chronic kidney disease, among others. Contraindication. Do not use cholecalciferol in the following cases. Hypercalcemia. Patients with primary hyperparathyroidism. Malignant disease. Williams syndrome. Mechanism of action. Most individuals naturally generate adequate amounts of vitamin D through ordinary dietary intake of vitamin D, in some foods like eggs, fish, and cheese, and natural photochemical conversion of the vitamin D3 precursor 7-dehydrocholesterol in the skin via exposure to sunlight. Conversely, vitamin D deficiency can often occur from a combination of insufficient exposure to sunlight, inadequate dietary intake of vitamin D, genetic defects with endogenous vitamin D receptors, or even severe liver or kidney disease. Such deficiency is known for resulting in conditions like rickets or osteoporosis, all of which reflect inadequate mineralization of bone, enhanced compensatory skeletal demineralization, resultant decreased calcium ion blood concentrations, and increases in the production and secretion of parathyroid hormone. Increases in parathyroid hormone stimulate the mobilization of skeletal calcium and the renal excretion of phosphorus. This enhanced mobilization of skeletal calcium leads towards porotic bone conditions. Ordinarily, while vitamin D3 is made naturally via photochemical processes in the skin, both itself and vitamin D2 can be found in various food and pharmaceutical sources as dietary supplements. The principal biological function of vitamin D is the maintenance of normal levels of serum calcium and phosphorus in the bloodstream by enhancing the efficacy of the small intestine to absorb these minerals from the diet. Half-life. At this time, there have been resources that document the half-life of cholecalciferol as being about 50 days, while other sources have noted that the half-life of calcitriol, 1,25-dihydroxyvitamin D3, is approximately 15 hours, while that of calcidiol, 25-hydroxyvitamin D3, is about 15 days. Dose. For vitamin D deficiency. For oral dosage form, capsules. Adults, 1 capsule, containing 5,000 international units, IU, once a day. Children, use and dose must be determined by your doctor. For oral dosage form, solution. Adults, 1 drop containing 1,000 international units, IU, once a day or 2 times per day. Infants and children, 1 drop containing 400 IU once a day. For oral dosage form, wafer. Children 6 years of age and older, 1 wafer containing 13,000 international units, IU, once a week for 6 weeks. Children younger than 6 years of age, use and dose must be determined by your doctor. Safety advice. It is recommended that you take a daily vitamin D, cholecalciferol, supplement of 400 IU throughout pregnancy. This will help you and your baby stay healthy. Many pregnancy multivitamins already contain 400 IU, 10 micrograms, of vitamin D, so if you're taking one of these, you will not need an extra vitamin D supplement. Dose. For vitamin D deficiency. For oral dosage form, capsules. Adults, 1 capsule containing 5,000 international units, IU, once a day. Children, use and dose must be determined by your doctor. For oral dosage form, solution. Adults, 1 drop containing 1,000 international units, IU, once a day or 2 times per day. Infants and children, 1 drop containing 400 IU once a day. For oral dosage form, wafer. Children 6 years of age and older, 1 wafer containing 13,000 international units, IU, once a week for 6 weeks. Children younger than 6 years of age, use and dose must be determined by your doctor.